This is ClinicalGuard AI, a multi-agent clinical decision support system built on Google's agent-to-agent protocol deployed on prompt opinion platform. I'll show you 5 real clinical queries answered in real time from live patient data. Our patient is Otha Durgan, 56 years old with CKD Stage 3A, hypertension, chronic pain and 9 concurrent medications. I asked ClinicalGuard to check for dangerous drug interactions. In under 10 seconds, the agent identifies 9 critical findings: a contraindicated NSAID in an NSAID allergic patient, a sulfonamide cross-reactivity with furosemide, a chelation interaction with iron and levothyroxine, and Tramadol seizure risk in the setting of CKD. This is reasoning across medications, allergies, and organ function simultaneously, something no rule-based system can do. Next, care gaps. ClinicalGuard returns a prioritized report. Liver function tests are 21 months overdue. CBC hasn't been repeated despite active anemia. TSH is completely missing despite ongoing levothyroxine therapy. The annual diabetic eye exam is overdue. COVID booster is 2 years late. And critically, the agent flags 2 allergy conflicts as discharge blockers: furosemide in sulfa-allergic patient, Naproxen in an NSAID to intolerant patient. Both are currently prescribed. ClinicalGuard didn't just list these gaps, it connected them directly to the medication list and flagged the clinical consequences. Third, renal dosing adjustment for CKD Stage 3A. The agent identifies 4 medications of concern. Tramadol requires dose reduction due to metabolite accumulation. Naproxen is nephrotoxic and contraindicated. Metformin is acceptable but must be held if eGFR drops below 45 or before contrast. And potassium is borderline high on concurrent AC inhibitor and diuretic therapy. Every finding is specific on this patient's actual lab values and actual drug list. Fourth, is this patient safe to discharge? The verdict is conditional. Vitals are stable, social readiness is confirmed, but there are 3 hard blockers. 1. Furosemide must be switched or tolerance formally documented. 2nd, Naproxen must be discontinued before discharge. And 3rd, liver function tests must be repeated before atorvastatin and tramadol can be clinically cleared. The agent does not give just a verdict. It tells you exactly what needs to happen and in what order. And that is what makes it much unique and much better. Finally, it also gives a medication risk summary for ICU handoff. ClinicalGuard produces structured brief covering allergy status, renal and hepatic baselines, and 3 immediate actions for the receiving team. This previously took a pharmacist 30 to 45 minutes manually. And here we tell you the gap that has been covered. ClinicalGuard does this in under 10 seconds from the live FHIR record. And that's the power of AI, and that's how AI has improved the work which was much more manual before. ClinicalGuard AI runs 4 specialist agents: medication safety, care gap, discharge readiness, and an orchestrator, all communicating via Google's A2A protocol over FHIR R4. Every answer you saw came from real structured clinical data, not a template, live FHIR queries. That is the AI factor, and thank you.